Hello, you're welcome to Dr. Abayomi Ajayi Live, and my name is Dr. Abayomi Ajayi. Well, uh, I hope you are staying safe and you're getting used to all our new normals. No handshake, no hugs. When you have to go out with your face mask, especially those of us who are living in Lagos, Abuja, and Ogun State, that we're going to start moving after a long while of hibernating. Now we're going to start moving tomorrow. Let me tell you, you have to stay safe. You know by now that coronavirus is not a joke. And so keep social distancing, and please use a face covering anytime you're going out to the public, and only go to things that are very, very important. Anyway, you're welcome once again. Today is Ask Me Anything, but before I go on, let me say Ramadan Mubarak to all of Muslim faithfuls who are doing the Ramadan. I've tried to group the questions because a lot of the questions came in. We might not be able to answer all of them, but as many as possible we'll try to answer, and we'll try to group them together so that there will be a slight flow, sort of. And then where the questions overlap, we just mention the name but take the answers together. So I'm starting with the Paiva Durosimi Yusra Taiwo. She says, I'm 37 years old. I'm a 37-year-old married woman and TTC for 7 years. I found out that I have endometriosis. Can I conceive with this, and what are my chances? Wonderful question. Okay, Mrs. Depaiva, you are 37 and you have endometriosis. I don't know how you found out that you have endometriosis, but that probably means you've started doing some evaluation because if you have been TTC for 7 years, you need to start doing evaluation. So probably you started doing some evaluation, but you know that age 37 is very important in a woman. Endometriosis also is so important because the two of them have effect on fertility, and therefore it's better that you start your treatment ASAP. All right. So if you have not been able to achieve a conception for 7 years, then definitely you will probably need help. So it will just be left for you to choose where you want to do your treatment so that you can be sure that you get the best out of it. I wish you the very best of luck. Yes, the next question is from Instagram. It's from Ebert Oven. And the question is a little bit related. She says, can IVF done with donor eggs for an endometriosis patient with severe adhesions be successful? Yeah, I don't know where the adhesions are. Adhesions can be in the abdomen and it can be in the uterus. Now, I guess that when you say severe adhesions, probably it's in the abdomen, okay? So, yes, if you are using donor eggs, you can be successful. Of course, your success rate also actually improves because that means your age probably is above 37, about 40, so you're probably using donor eggs. What I just want us to be clear about is that the adhesions are not in the uterus, by which case you need to do a procedure we call hysteroscopy. But I'm sure your doctor will get to do that for you. So I wish you also the very best of luck, and then please take care. Mrs. Toyin Anike Olajide Awe, she says, I'm a 48 years old woman, married for 8 years. I've done IVF once 5 years ago. Now that I want to do it again, I'm told my womb is retaining water, so I can't carry an embryo. Seriously, I'm at a loss about that. But probably what we're talking about is that your fallopian tube, which is not the womb, your fallopian tube has some water, what we call hydrosalpinges. Maybe that's what you're talking about. But it does not mean that you cannot carry an embryo. So it's a little bit trickish, but I don't know who you are talking to. Probably you need a second opinion, or probably you are not getting the gist right for now. But I think there's so many things that are important here. Number one is your age. Okay, you've done IVF once. At 48, seriously, we must think of you using donor eggs. So you must have to talk to your doctor you must have to see where this water in your womb, really, I don't get it, except it's in the fallopian tubes, where the doctor might be talking about first clipping off the fallopian tube before doing the treatment, because that's been shown to improve the success rate of IVF. This is what I'm saying. The fallopian tube is different from the womb. The fallopian tube opens into the womb. Fallopian tube is where fertilization takes place, and then the embryo is now transferred into the womb. Now, if you're doing IVF and you have fluid in your fallopian tube, because it's connected to the womb, it's possible that it can flow back into the womb and therefore reduce the success rate of IVF. And that's why doctors usually advise that before you do an IVF, you clip off. You don't even need to open up completely. It's just a laparoscopic surgery. Clip off the fallopian tube, and then before you do your IVF. Please kindly like and share this video with your friends and followers. It's important that we can share knowledge, especially these days. Evangelist Awoyeye Oluremi Alafia says, I've been trying to get pregnant after my 12 years of marriage. When I conceived, when it's about 6 weeks, the pregnancy will abort. I complained to my doctor. They said I have fibroid and I have to remove it. This is my 4th time of losing a pregnancy when it's about 6 weeks of gestation. Please, doctor, what is the problem, sir? Okay, if you've been married for 12 years, I guess you didn't tell us your age. So if you've been married for 12 years, maybe age is one of the things that we're dealing with here. Okay, and age also increases the chance of you losing pregnancy, especially in the first trimester. You know, we say that about 75% of pregnancy loss in the first trimester, the first 3 months of pregnancy, is because these pregnancies have some problems at the cellular level, what we call chromosomal problems. So, and this is the age, it's one of the risk factors for this. If a woman is above 37, 40, then the risk of having this problem is higher. But I think you need to, fibroids usually do not lead to first trimester miscarriage. They can, but usually they don't. But we might, you might need to have a wholesome assessment, but especially let's know what the age is. Probably if you can still send me a message, I'll be willing to look at this. Biola Obashino says, what's the rate of success for IVF for a woman over 40 years? Well, that's a wonderful question also. When you're above 40, the chances that you conceive either naturally or by IVF reduces. One thing we need to get right is that because what we're using, the raw materials we're using in IVF, are actually the raw materials that nature also uses, okay, except if you are using donor eggs. Now, our success rate is not too far away from one another, and we know that at 40, the chances that you get pregnant and have a live baby is even less than when the fact that you can have a miscarriage. So in IVF, we say that your chances of conception when you are using your own eggs and you are over 40 is just about 12 to 15%. So that's what the answer to your question is, you know. But plus 40 plus can mean 41, can mean 42, can mean 52. So that's a wide range that you have given. So I might not be able to do justice to your question. I can only say from when you said above 40, and that's all I can say. But of course, the success rate gets worse as you get older than 40. So my next question is from Olajumoke Oguneye, and she says, I'm 57 years, going 58, sorry. Can I still conceive and have my own child? And the answer is yes, you can. But probably you will need IVF. And that's, you can talk to your doctor, and then that can be made possible. Oluwabusayo Ogunshekonmeya. What can a TTC woman of 44 years use to restore her menstrual flow that stopped since September 2019? Thanks, sir. Now, one thing I want us to get right, which there's always a confusion, is the fact that you are menstruating regularly does not even mean that you can have a baby. Okay? So when women come and say they want to restore their menstrual flow, if your menstrual flow has stopped and you have reached menopause, we can give you drugs to make you bleed, but that does not make you be able to get pregnant. So we need to differentiate between, just because menstrual bleeding just comes from your uterus. It just shows that the lining of your uterus is shed. All right. So it's possible for us to give you drugs to be able to shed that, but that does not mean you are able to have a baby, because to have a baby you need to still have eggs that are viable, and it is when the sperm has fertilized these viable eggs that you can have a baby. So they're two different things. If you just want to restore your menstrual flow, it's different from that you want to have a baby. And I'm sure what you're talking about is about having a baby. So not the important thing is in having a baby, not in restoring your menstrual flow. And a very good IVF facility can help you with that. So I guess you will need to go and talk to a doctor who can help you with that. Now, my next question is from Bolaji Tubosuma Konjola, and he says, greetings, sir. Please, sir, I would like to treat azoospermia. I want to take it together with the next question, which is from Busayo Abiodun, who says, what are the possible causes of low sperm count? Low sperm count is oligospermia, reduced sperm count, okay? Azoospermia is no sperm count. And that's why they're related, so I want to take them together. You know, we say that when sperm count is below 15 million now, it's low, all right? 15 million per mil. Now, but in azoospermia, there is no sperm count at all. But usually it goes from oligo to azo. I know there's some people who just are azo. Now, what are the causes of this deranged sperm count? Okay, we look at medical reasons. Either some people are born that way, they inherited it. Some people have what we call varicocele. Some people have some infection that have not been well treated. Some people have undescended testes, yeah. And then some people have been on some medications that can reduce their sperm count, ultimately leading to no sperm count. And then there are environmental causes, which will include probably where you walk, you know, the environmental things that you are exposed to, and then also we have what we call lifestyle causes: alcohol, cigarette smoking, and use of weed, which is very, very common in young people these days. You know, so those are some of the things that could cause either low sperm count or no sperm count. Now, why I'm taking this together is I want to say it again, that as of 2020, we still don't have drugs that will help you when your sperm count is low. Therefore, especially when it's below 5 million, what we have will be for you to do what we call ICSI, which is a variant of IVF. All right? And therefore, because I see so many people who have 2 million sperm count, and they are running from pillar to post using all kinds of drugs. Some of them, they say they are natural. Come on, in medicine we say it must be evidence-based. You remember what is happening, the discourse between Donald Trump and his medical people. Yeah, when it started with hydroxychloroquine, and they were saying, take it easy, this is not proven yet. The same thing, there is nothing proven with low sperm count yet. So I'll just say take it easy with all this. I don't want to mention any drugs, but there is a big business on that. Now, if you have azoospermia, there is no sperm count at all, then right now we can also help you when you do IVF. But the first thing that the doctor will first examine you, take your history, and then see what is there anything that can be done. Is there any, because tumors also can present this way. If you see that there is no tumor, then we can do what we can go to the testes, which is like the factory for the sperm, to be able to see if we can get sperm from the factory. If now we cannot get, we might talk about use of donor sperm. But these are all the possibilities that we can use for azoospermia. But let me tell you something. about 15% of men actually have azoospermia. So when you people come down with this diagnosis of azoospermia, what they first look at is, oh, why me? Oh, what? But seriously, about 15% of men in their reproductive age have azoospermia. And we did a study examining 907 men, even here in this institution, and we saw that the incidence of azoospermia in our environment in the clinic was about 12%. So it's not something that is uncommon. That's what I'm trying to say. But and many people with azoospermia have fathered children. So you can father children. Okay. So I wish you also the very best of luck. The next question is Mami Kunadu, who says, please sir, my question is, can women with negative blood give birth after 3 abortions? Well, this question is a little bit tricky, but I'm interpreting to mean O negative blood, resource negative blood, okay, all right, because there is no negative blood. But if you're talking about resource negative blood, can they give birth? Because what happens in resource negative, especially when your partner is resource positive, is that you develop antibodies to the antigen from your partner, and this, if your baby is resource positive, will affect your baby, and then sometimes you will have abortions. But mind you, it is not actually not abortions per se. It is miscarriage or intrauterine death, because these deaths usually occur late in pregnancy, after the 2nd trimester. So we need to be clear about some of these things, because I've seen people saying that it's because you have resource negative blood, that's why you're not getting pregnant. Nope, that's not true. All right. So usually what happens is that you get pregnant, but you can lose the pregnancy, and like I said, later on, most of the time, the babies usually have a way of dying in the womb. But this can also be detected by you doing some tests. If you go to the doctor there, of course, fortunately, it's not a very common thing anymore because of the fact that you can take the injection that can neutralize these antibodies. So I wish you also the very best, but talk to a doctor, and if you want to talk to me later on, you're free to do that. Now, Desiree Darling, is there really anything like unexplainable infertility? In other words, this is unexplained infertility. And I'm going to take it with the next question, which is from Oguchuku Obina. Doctor, in the case where you and your partner are certified medically okay, what should be done? Okay, so I take this to be the two of them to be asking the same thing, unexplained infertility. In about 10 to 15% of patients in this environment, we do the basic test for infertility, and we don't find out why they are not able to achieve pregnancy. Okay, so this is usually called unexplained infertility, right? But before you can label anything unexplained infertility, the patient should have done the seminal fluid analysis, will have done HSG to see that the X-ray to see that the tubes are open, will have done test to see that she's ovulating, and then she will have done a scan. So those 4 tests will have been done before you can label anybody unexplained infertility. Now, if those 4 tests cannot get any results, then we can say unexplained infertility. And we know that even unexplained infertility depends on how far you want to go. For example, if you do a laparoscopy, you might be able to discover more things. We have seen that the commonest causes of unexplained infertility are 1, age of the woman, because with age you might not just see anything. Every test might be okay, but age might just be the only reason why she's not getting pregnant. The second thing is also with mild endometriosis, and that's why if you do laparoscopy, you might be able to see that. So without laparoscopy, of course, you might not be able to see that. And the third reason why we have unexplained infertility, it's with the sperm in the union. There's something we call DFI, or we see the degradation in the DNA fragmentation index. We see the degradation in the DNA in the sperm, and that usually, unless you test for it, you are not going to see, because the sperm count will be okay, everything seems okay, but it's at the point at which the sperm is supposed to do its work that it doesn't do a good job, because the DNA is carrying already fragmented. So those are the things that can cause unexplained infertility. Of course, we can do IVF also to be able to straighten that out. Now, the next question is Ami Favor Ezechi. She says, can someone with one fallopian tube become pregnant naturally? And is there a solution to blocked tubes? And why is IVF not successful these days? Three questions in one. Okay, all right. Well, any paired organ is a luxury. That's what we're taught when we're in medical school. So if you have one fallopian tube is blocked, you can still get pregnant. The only problem is that if you get pregnant in that blocked fallopian tube, you could have an ectopic pregnancy. All right. So, but you can get pregnant with one fallopian tube, and so many people have even been pregnant after one ectopic pregnancy in which one fallopian tube has been chopped off, as it were. So it's possible to get pregnant with one fallopian tube. But if the two tubes are blocked, then you probably will not be able to get pregnant unless you do IVF. And she says, why is IVF not successful these days? I don't understand, because I know IVF is very successful, but I want to talk about that when I think somebody also asked me about failed IVF. So I'm going to try to take that with why IVF fails and why the expectation of our patients sometimes is not right when it comes to IVF. And the next question says, is from Instagram, Jalo Stabo. I never know how these Instagram names are, but okay, I hope you. My husband does not rest. He's always working. We have been married for more than 3 years without a child. The hospital told us he has a low sperm count. Is his overworking part of the problem for his low sperm count? Well, I don't know what work he does, but it's not. Nobody ever has low sperm count from working, except the environment in which you work is deleterious to your sperm count. So I don't know what he does, but sperm count, just like they say, hard work never kills nobody. So if everything is okay, the environment is okay, the work does not debar you from getting pregnant. What you need to do is to have a proper evaluation and treatment. If you have stayed for 3 years, then this is the time for you to be looking at how to have treatment in order for you to be able to have baby or babies. Another question from Instagram is from Ella Langsy. What is the success rate of IUI for a woman age 33 with a normal cycle, ovulates normally, no blocked fallopian tube? Yeah, for you to be able to do IUI, actually, your fallopian tubes should not be blocked. You should also, your age is good. You should have normal cycle. So this is a proper candidate for IUI. The success rate of IUI is about 15 to 20 per cycle. So I wish you luck if that is what you're doing. But if you have done about 3 failed IUIs, then you might have to proceed to doing IVF. So I'm going next to the question from Tari Obotimombo. And she says, I've done IUI, IVF in your branch at Asaba, but it failed. I'm still looking forward to another. How can you help me? Well, I think this, Tari, I'll just say get in touch with your nurse, and then we'll see how we can do that. But I'm taking it together with the other questions that from Omobolanle Akiyemi. Why is it that some IVF is not successful? Yeah, and that's one question that I want us to look at. Why is it that IVF is not successful? That's one question I get asked so many times. And, you know, I think it has to do with a lot of things. One, we know that IVF can fail at different points, all right? Even before we do a transfer. For some people don't have a transfer at all. If you don't have a transfer, that means either your egg production was not good enough, either you are older than the person that should be using on eggs, or it just comes from the blues that you don't produce enough eggs and there is nothing to fertilize. And that one is, we know that once we have not transferred anything, we are not going to have anything at the end of the day. So, but for people who have gone through the cycle, everything seems to have been okay. They ask me the question, Why has this failed? And sometimes it's a difficult question to answer, especially at that point in time where everything is sore, you know. But let us get some things right about IVF. And this is one opportunity, since this time I'm not talking to a particular person. I want people to understand what to expect from IVF to start with. You know, nobody buys a car and expects it to start flying. So you need to understand the technology itself before you know how to expect anything from it. Now, don't get me wrong. I know Nigeria is peculiar, but we're not the only country where you pay everything out of pocket. All right? And that is also one of the things that makes failure in IVF to be very painful. Also, the fact that we think that IVF is a magic bullet, that we can stay, it's just like the last resort. It's when every other thing has not worked that we turn to IVF. Most of the time, by the time we're turning to IVF, we're over 37 years. And the success rate of IVF is age dependent. So, what am I saying? I'm saying that if you need IVF, please start early. Now, I'm going to look at a study that was done and published in the Journal of American Medical Association, where they looked at in the UK, they looked about 157,000 women, looked at their cycle, and saw that averagely for you to have a baby, they did an average of 2.7 cycles. Only one attempt for all the 157,000 women, the success rate of one attempt was about 29.5%. That is, for 3 out of 10 will take a baby home after only one attempt. But when you break this down to age, then it becomes glaring. For women below 40, is this 3 out of 10. For women between 40 and 42, is about 12% success rate. For women greater than 42, is about 4% success rate. And what they saw was that this 29.5% success rate per cycle seems to be steady for the first 4 cycles. But one interesting thing they noted was that at the 6th attempt, success rate seemed to jump to about 65%. So what is this all about? IVF is a marathon. It is not a sprint. Some people will get it right by doing one cycle, but majority of the people we need to do more than one cycle. And that is one of the things that we fight with all the time, that people think once they do one cycle of IVF, they must get a baby. And all over the world, it is not like that. In fact, I know a clinic in the US who says on their website that if you are thinking of only doing one cycle, this is not the place for you. So we need to get it right that IVF might not succeed the first time. Yes, I know some people, they've done 3 IVF cycles, they have 3 babies. Each time they are successful. Yes, but that is not the average person. It happens. You can do it once and get a baby, but majority of the people will have done it 2 times. So that's the way I will answer that question. Now, to M.A. Obuna, how do you manage hypothyroidism with IVF? I just love this question, because this is one of the things that we're saying now, that undiagnosed thyroid problems, it's something that we're seeing in fertility clinics. And that's why some clinics now have introduced that they do the thyroid stimulating hormone as part of their workup, so that they can pick up the few problems with the thyroid function. And the good thing about hypothyroidism is that all you just need to do is to give a thyroid supplement, but that must be done before you do your IVF. So it's important to make a diagnosis of this hypothyroidism, and it's important for it to be attended to before you do IVF. Mobolanle Akoshile Boboye says, hello sir, I've done IVF in 2016, but it failed. I'm trying to go for another one after the lockdown. What can I be taking for me to come out successful? I will be 46 years old by July. Well, I'm happy that you asked this question, Mrs. Boboye. There is nothing I'm going to advise you to take. More than one thing you should do is that you should be using donor eggs if you're 46. Let me make your doctor's work much easy for him. Yes, I'm not saying just take it like that, because you will need some counseling also for this to happen. But if you are 46, and that's what we're getting now, a lot of 46, 52-year-olds are coming to the IVF clinic and they're saying they want to use their eggs. You know what? I just told you, if you're over 42, the chance that you will succeed is less than 4%. So if you are 46, please, the only reasonable thing to do is to use donor eggs, and God bless you as you do that. Eunice Abutu Emmanuel, he says, Doctor, good morning, sir. I've done fibroid surgery 2 years ago, but my period is not regular. I went for scan. Doctor told me it's because I'm not ovulating. That's why. I did my test. Okay, I don't want to. Where she did that test? What drugs can I take to make my period regular and to boost my ovulation, sir? You see, that's the thing. People are always talking about this regular period. Okay. She's done surgery 2 years ago, and then her period became irregular. Now, she didn't tell us her age, so we don't know whether it's menopause. But if she's not reached menopause, what will have happened? Because, you know, when you bleed, what you shed is the inner lining of your uterus, what we call the endometrium. So it's possible that the endometrium has been scarred during the surgery, not because the doctor did that intentionally, but what we have found out is that a lot of scarring takes place when doctors are removing fibroids. We did a review of about 900 patients in this clinic where we looked at their womb through what we call the hysteroscope. And we saw that 30% of them have scarring, all right? So out of the 900, about 300 had scarring. And the majority of them came from removing fibroids. The second thing was cesarean section, but fibroids was number one. So sometimes inadvertently, especially when the fibroid is located where the baby should be, and the doctors have to enter from the outside into the inside of the uterus, they usually will leave scars, you know, because when you cut something and you suture it together, you are not in control of the healing. So usually scars will form, and that we've been able to see by doing hysteroscopy. So when the fibroid is in the place where the baby is supposed to be, which we call submucous fibroid, the best way to remove it is through the hysteroscope. So, but the only problem with that is that the other fibroids might be left alone. So, but if your menses have been irregular, especially after surgery, and you have not reached it's not that you have reached the age of menopause, then you must be doing something we call hysteroscopy to look inside your uterus. Another question from Ade Jasper Felix Jasper. Hello, sir. My wife had a fibroid surgery last year, November, but up till now, she has not been able to get pregnant. Please, what can we use to boost her fertility and also boost my sperm count? Well, fibroids rarely lead to infertility. So, if you already have a reason why you have not been able to have a baby, then that's what we need to face. If the fibroid is out of the way and is not left any scar, then what we need to be doing is why I've told you, as of 2020, there's still no drug that we say boost sperm. And the part of the fertility that you want to boost, I really don't know. So it's important for us to have a good evaluation and then outline how the treatment will be. Okay. The next question, I'm trying to take as many questions as possible, is from Sarah Idowu, and she's talking about treatment for polycystic ovarian syndrome. And I think the next question from Augusta Okoye also says, I have polycystic ovarian syndrome and amenorrhea, and I'm trying to conceive. What can I do to achieve pregnancy? All right. Now, polycystic ovarian syndrome and amenorrhea. Amenorrhea means that you are not menstruating regularly or you are not seeing your menses regularly. So, it's one of the things that polycystic ovarian syndrome can cause. Actually, there are three things that you have to look out for in polycystic ovarian syndrome, and two out of these three must be present for you to talk about polycystic ovarian syndrome. The first being that your cycles will be irregular or even absent. You menstruate less than 5 times in a year. Or the second thing is that you will have features of high male hormone in your body. Either this is seen from your blood test, or you have clinical manifestation. Either you have male hair distribution, either you have hair in your chin or your chest, or you have your balding, the male balding pattern, or and then the third thing is that you have polycystic ovaries on scan, and two out of these three, once they are present, then you qualify to have PCOS. But so the treatment of polycystic ovarian syndrome usually starts from lifestyle changes. One of the things is that about 50% of these people are also obese, and so they need to lose weight. Everybody with polycystic ovarian syndrome, when they lose weight, they get is better for them. Okay, and then the drugs that they can probably sometimes their drugs are prescribed which can make them to ovulate. It depends on what the problem that you have is. For example, Mrs. Okoye, if she's not trying to get a baby, if all she has is that she's not seeing her menses, it's possible for us to give her drugs to make her to bleed. You know, so if she depends on what the problem that you have with it is. But one other thing that we need to know about polycystic ovarian syndrome is that in later life it can predispose you to having diabetes. So it's something, and cardiac diseases. So you are the kind of person, and when you're pregnant also you could have pregnancy-induced both hypertension and diabetes. So you need follow-up in later life. So you are somebody, when you are over 40, you should be having your annual assessment in order for you to be, and then you should not put on weight. But if infertility is the issue now, of course, that can also be taken care of from either you are losing weight or you are using drugs, or sometimes if there are other problems, you might be doing IVF. Now, Egele Vera. I did operation 2017 when I was pregnant of my first baby, but the baby died in my womb. After the operation till now, I've not seen my menstruation. I did HSG test, which says I have apadilapinemia. I don't understand this, and I'm 33 years old. What do I do, please? Okay. I don't understand, but the part I understand there is that you did a surgery, and because the baby died in utero, and therefore you have not seen your menses again. You know, we've been talking about where menses comes from. Okay, the menses is from shedding the inner lining of the uterus, but the things that trigger it off actually are in the brain. So, and the ovaries, you know. So the brain triggers everything, and then the ovaries respond, and then makes the uterus to bleed. So sometimes you did not tell us whether you had blood transfusion. Some people bleed so much during surgery and they can't see their menses again. It's different from when you are not seeing your menses because the lining of the uterus has some issues. Either it was sutured and it did not recover well because of scarring or whatever there. But so it's difficult for me to say, but what you need to do is to act now. I don't think it's drugs alone. The first thing is we must know why you are not bleeding, and it's not out of place also to be talking about hysteroscopy here, but I don't have the full history, so it might just be very difficult for me. But if you want me to give an opinion, give me all the details and send it to the email that info at nordicalagos.org, and I'll be able to do that. Then Prince Akiyemi Olalekan says, hello sir, we've been married for 5 years now and my wife is 34 now since 2018. Anytime she's pregnant, after 2 to 5 weeks, we just see blood, and if we go to the hospital, they tell us that the pregnancy is gone. What's your advice, sir? Well, it's a little bit of a tough call, in the sense that sometimes are we sure that you're really pregnant? Because 2 to 5 weeks pregnancy, how was it confirmed? Was it by doing pregnancy test, or because by 5 weeks you probably cannot see from scan whether there is a baby there. So that's why I say it's a little bit difficult for us to know whether your wife was actually pregnant. But we take it that she was pregnant, and then, but what we need is a good assessment, and then we'll be able to know what exactly to do for you. Loretta Stephen Williams. At what stage will a couple opt for an IVF, sir? Yeah, this is the question I tried to answer earlier on, that it's not a matter of say what stage. What we try to say is this: everything depends on the age of the woman, all right? If you are below 35 and you've been having adequate sexual intercourse and you're not pregnant, after 1 year, you should see a gynecologist, all right? And then we will start the process. If you are over 35, after 6 months, you must see the doctor and see, because you might need to hasten things up and start your treatment quickly, because you remember we said 37 for a woman is a very critical year. So before that happens, you need to start doing something active, so that before we now start talking about the decline in reproductive capability, and sometimes we want to use donor eggs. So it's individualized. What is the age of the woman? How long have we been trying? For some also, there is no other choice. You already know that your tubes are blocked. There is no other choice. You already know that your husband's sperm count is very low. There is no other choice. So it's not. So when the indication is there, please don't let us tarry. We should just start doing it on time. I think there is some, maybe 1 or 2 more questions. Someone says, what is the benefit of hysteroscopy? Okay, well, yes, we've been talking about hysteroscopy. Maybe I'll talk about a little bit about the procedure. Hysteroscopy is a procedure whereby you have something like a pen, which has a light source in front of it, which you take into the uterus, through the vagina into the cervix. You don't cut open at all, and you're able to see the inside of the uterus. The good thing about it is that you can also do some surgeries through this small hole. So it's useful for people who have fibroids, especially when the fibroids is where the baby should be. It's useful for people who are not, for the person who says I'm not bleeding after surgery. It's very useful for such people. So, and also it's just useful sometimes when we are doing IVF and we think that there might be something in your uterus. So it's procedure, and it's a 15-20 minutes procedure. So it's something that you should do, but it can be done also under anesthesia, especially when surgery is going to be done. Now, if I've not been able to answer your questions, please send a message on info@abayomiajayi.com.ng. So I'll be willing to answer all your questions if your questions are not being taken care of. There's still so many questions, but I think it's at this point that I'm going to draw the curtains for this week. It's been great talking to you all, but please do take care of yourself. Coronavirus is real and it's a killer, but it does not have to kill if we obey all what our health officials are telling us. Once we can make a diagnosis easily, or early, once you can isolate to prevent the spread of coronavirus, once you can keep a respectable distance or what we call social distancing. Once you can use your mask to prevent spread, and then when you have fever, please report straight to the doctor, or you are coughing, because you have symptoms that you just think is not your usual self, then you should let the doctor know. It's at this point that I'm going to see you in 2 weeks' time. Please do take care of yourself, and I'll see you.